Good afternoon, Professor Brown. Thank you for joining me this afternoon as I make my stand for supporting hospital price transparency and examining how healthcare reform, specifically Medicaid expansion, has financially impacted health service organizations across the United States. Transparency in healthcare pricing isn't just a regulatory issue, it's more about fairness, trust, and financial sustainability for those in low-income families. I would also like to explore one of the case studies that was done in Michigan and how it has actually improved the access to care over time. The first question we have to ask ourselves is, what is hospital transparency? So in 2021, there was a hospital price transparency rule that was implemented that required United States hospitals to provide clear, accessible pricing online for all services that they offer. It was two types of information that was required, and that was a comprehensive list of all items and services, and then a consumer-friendly display of all the shoppable services that they can utilize. So the goal is to help the consumers make informed decisions, but also to encourage competition to where we would drive down overall healthcare services and costs based off of others and their prices that they see around in the same vicinity as them. So why does transparency matter? So let's just face it, this is long overdue for the United States. Patients not only have to worry about receiving bills weeks, sometimes months, sometimes years later, once it decides it wants to be billed. Price transparency shifts that dynamic and makes it more empowering to the patient to understand and know what they're paying for up front before they even elect to have the service that's going to be provided to them. Why does this matter? So a case study actually shows a significant price variation for the same services in the same city and even in the same hospital, just depending on which department they're actually in. So according to a 2022 study by the Healthcare Cost Institute, common procedures like MRIs range from $300 to $3,000 in the same city, same state, sometimes just a 15 to 20 minute drive up the road. That is ridiculous. This lack of predictability causes financial stress, and it also erodes the trust that individuals have in the healthcare system. There's been a few successes and setbacks according to the reforms and the rules that have been implemented. So raising the penalties has definitely increased our compliance from the non-compliance rate that we had when we first started. So once we made the increase in penalties to larger hospitals, we've seen a compliance rise from nearly 75% in 2024. However, challenges still remain because some hospitals struggle to interpret and or implement the requirements that are outlined. Others fear losing the competitive edge from giving out their prices across the United States. And then transparency is not just about posting data. It's about ensuring that the consumer, the patient, and the provider that's actually giving those services understand and that it's a usable source that they can utilize to actually bill. The role of the healthcare reform. So let's talk about the healthcare reform for a second. So one of the most impactful reforms in recent history is the expansion of Medicaid, better known as the Affordable Care Act. The state of Michigan was actually one of the most valuable case studies that was done on this specific expansion. So research from an article titled Macroeconomic Feedback Effects of Medicaid Expansion, Evidence from Michigan, found that the expansion reduced uncompensated care by nearly 50%. Hospitals experienced a financial gain because the tax revenue actually supported the economic activity, and these savings that they actually got was reinvested back into the health program, which ultimately increased their access to care. How has Medicaid helped expand or help hospitals, right? So when it comes to Medicaid expansion, the benefits are ridiculous. So it provides financial stability. It actually also improves rural hospitals because it has fewer closures in those areas due to the expansion of Medicaid. And then it also grew the workforce field because the underserved areas was needing more providers, nurses, doctors, administrators, and et cetera. So according to 2018 New England Journal of Medicine study, hospitals in expansion states saw a 6.1% increase in operating margins compared to those in non-expansion areas. Transparency and reform, they have a shared goal, right? So their ultimate goal is to ensure that it's affordable, that everyone is accountable, and everyone improves the access to care. And then it's patient-centered. So my final thoughts to sum this up is hospitals' price transparency empowers patients and promotes fair competition. It increases enforcement, support, and education. Medicaid expansion has demonstrated measurable economic and health system benefits. And lastly, the financial health of hospitals improves when reforms address both revenue and access. Thank you for taking the time to listen to me today. Hopefully you agree with me that price transparency is important.